So good afternoon to all of you. In this videos I am going to discuss about another topic, that is the hemostatic agent. So hemostatic agents, first you have to understand what is the hemostasis. Hemostasis is a process of forming blood clots, process of forming clots in the walls of damaged blood vessels, in the walls of damaged blood vessels. So that is we called hemostasis, right? Hemostasis is a process of forming clots in the walls of damaged blood vessels. So it stops the bleeding, hemorrhage or blood flow. And these hemostatic agents are the drugs or the agents. Hemostatic agents, what they do, they improve the primary improve primary hemostasis. They stimulate thrombin generations, inhibit the fibrinolysis, These are the hemostatic agents. And hemostatic agent drugs are aprotinin. This is the first one, aprotinin. Second is desmopressins. Another is epsilon aminocaproic acid. Another is tranexamic acid. So these are the hemostatic agents: aprotinin, desmopressin, epsilon aminocaproic acid, and tranexamic acids. So aproprotein, one by one I am going to discuss. Aproprotein is a serine proteinase inhibitors. This is the serine proteinase inhibitors. So what it do, these aproproteins inhibit the broad spectrum proteases. These aproproteins inhibit the broad spectrum proteases. It inhibit, right? Like including like plasmin, it inhibits the trypsin, it inhibits the kallikrein, inhibit the chymotrypsin, activated protein C, thrombin, right? So these are the aproprotein, and these are used in reduced blood transfusion in coronary arteries bypass grafting. It's used CAVC, that is we called coronary artery bypass grafting. So during that procedure it's useful. Another drug is desmopressin is what it do. Desmopressin used in prevention and treatment of bleeding in patients with von Willebrand disease. That is its use is desmopressin is prevention and treatment of bleeding in patient, particularly in the patients with whose defect in wall von Willebrand disease, that is a VWD, right? So this is useful in that ones. Epsilon amino caproic acid is, or this tranexamic acid is, these are synthetic lysine analogs. These 3 and 4 are synthetic lysine analogs which particularly inhibit the plasminogens. So which results these uses is they decrease the bleeding in cardiac surgery or any other surgery. They are useful, right? So this is about the hemostatic agents. Next in your syllabus is integrin as a therapeutic agents. So in next videos I will discuss about integrin as a therapeutic